A second vaccine for COVID-19 is under FDA review now to receive full approval for use in adults. So here to explain what that means is Dr. Helen Boucher, Chief of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Dr. Boucher, good to see you.
Nice to see you, Ben.
All right, so right now we know there are 3 vaccines authorized in the U.S. for emergency use. Well, today Moderna submitted its application to the FDA for that full approval, just weeks after Pfizer did the same for its vaccine. Why does this matter, especially now that millions of us have already received the shots?
Well, this is a good signal that we have enough efficacy and safety data for the sponsor companies, Pfizer and Moderna, to file a full application. So if this application is reviewed by the FDA and their external advisory committee and then the CDC, it will be able to be prescribed just like we prescribe other vaccines and marketed for sale across the country.
Would full approval from the FDA change anything about the way the vaccines are monitored or they're tracked?
Well, it would change the fact that they can now be prescribed, so they won't be in a clinical trial, but they will still be tracked according to the Vaccine Adverse Events Response System at CDC, so that very good tracking mechanism that's in place for all vaccines. So we can be very reassured that there'll be continued monitoring for safety and efficacy. Also, the studies in children will be ongoing, right? These approvals are for adults.
All right, you mentioned children. That leads me to the next question. On Saturday, as we know, Massachusetts lifted most of its COVID restrictions, including the mask mandate and the capacity limits. We've talked with a lot of people today and over the weekend who kind of seem to be struggling with this phase of the reopening. That would include me, I'll be honest with you, as the parent of 2 children under the age of 12. So my question for you, how are you handling it? And are there any places perhaps you're still wearing the mask? Maybe the grocery store?
Yeah, well, this is a really good question. And I think everyone's going to become comfortable being more social and active in different time frames, and that's fine. So our advice is really to wear that mask if you're more comfortable. As we've talked about before, outside is safer than inside. And it's really those crowded indoor places when you're going to be among perhaps unvaccinated individuals where you need to make a decision about how comfortable you are. So as you mentioned, Ben, the grocery store, I might still wear a mask in a crowded grocery store for a little while. I'm human too, and I'm not quite totally comfortable yet either. And I think that's fine. And we should really respect each other's decisions about when and where to wear that mask.
So is there any situation, such as maybe a packed restaurant or a full stadium, that you would plan to avoid still for now?
Yeah, maybe a packed indoor bar or something. I'm really happy to be doing things outside, to be seeing my friends and to be socializing with groups where I know we're all vaccinated. I think when there are mixtures of vaccinated and unvaccinated people, especially indoors where there might not be great ventilation, that's where I might be a little more cautious still.
All right, good advice. Dr. Helen Boucher, Chief of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Dr. Boucher, thanks for your time.
Thank you.